What's going on, guys? Dr. Greg here. Today we're going to talk about how to use a softball or lacrosse ball and do some self-myofascial release techniques to decrease some knee pain you've been having. So when you have what I would call anterior knee pain, so pain around or under the kneecap, below the kneecap in the patellar tendon or above in the quad tendon, some of these structures get really achy and really painful. And what I usually find is the patients that have this type of pain typically overuse their quads in quad dominant exercises like squats and lunges. You know, those are very quad dominant exercises. And they also have inflexibility in the quad muscle and the hip flexors. So this is a good way to release some of those tissues, release some of that tension, get some flexibility. And then, you know, other things that we have to do is to maybe make the glutes more active, but today we're going to focus on how to release these, how to make your knee better in the short term, and how to recover after those heavy leg days. All right, guys, so what you're going to do is you get on your belly and you're going to take that softball or lacrosse ball or whatever kind of myofascial release tool that you're going to be using. You can even use a foam roller if that's all you have. You're going to place that ball right in the middle of the quadriceps muscle, just a couple of inches above the kneecap, and then you're going to lay right on top of that. So you're going to find that spot that's a little tender, usually right in the middle of that quad. And from there, I'm going to do some active knee flexion. So I'm going to be bending my knee back and forth, okay? What I want you to do is do about 5-10 reps of that. It's going to be uncomfortable. If it's too uncomfortable, back off a little bit. Don't put so much weight through it. Make sure that you're able to breathe and that your body's not kind of perceiving this as a really threatening situation for you, okay? You want to be able to move through that movement with some discomfort, but not too much pain that you can't breathe, okay? So like I said, 5 to 10 passes at that stage, and then you're going to move it up kind of into that mid quad. You're going to go back in that same position, put some pressure through. Again, 5 to 10 passes. What you want to make sure too is that you're not arching your lower back too much. Keep that glute kind of tight, keep that glute squeezed a little bit so that you're really isolating that quadriceps muscle. And then you'll move it up again to the upper third of that quad in that hip flexor region and repeat again, okay? So like I said, 5 to 10 passes at each stage, and you're gonna start to feel better in your knees when you're doing those heavy squats, those heavy lunges, and you're not gonna have as much tension compressing that knee joint or pulling on those tendinous regions of the muscle. So try that out, let me know how it goes. If you have any questions, let us know.